Neurology in Primary Care, developed by Templeton Institute for Neurology. Templeton Institute for Neurology is a comprehensive neurology practice dedicated to the diagnosis and treatment of neurologic disease. We are located in San Luis Obispo, with a satellite office in North County. Our Neurology Second Opinion Clinic in San Francisco is held once a month. We apply the same excellent standards we use assessing patients who see us for an initial consult to the patients who see us for a second or third opinion. This is why our success rate is more than 38% in changing diagnosis or treatment when we do a neurology second opinion. We do not promise miracles, but we frequently change quality of life. This review, even though it's comprehensive, should not be used as the sole source for physicians when they are making decisions regarding treatment of their patients.
This is Alpha O'Neill with Neurology in Primary Care, presented by Templeton Institute for Neurology. And today we're here with Jamie Guerra. He is our preferred specialist in the field of physical therapy. And welcome to the show.
Thank you.
Thank you so much for coming and meeting with us. We want you to talk about a couple exercises, discuss two sets of exercises. The first part focuses on the cervical neck area to help patients prevent radiculopathy and develop symptoms or prevent developing symptoms of degenerative disc disease. So what would you say are some specific exercises that would help with that?
Well, it's any exercises that are going to counteract the thing that we all do most that we're not built at all to do, and that's sit. That's none of our faults. Everybody says, well, I sit with bad posture. Everybody sits with bad posture. It's sitting. I mean, that's the way it goes. You can try all you want to sit up tall, but you have to think about that. And if you think about that, you can't concentrate on the road, can't concentrate on your work.
Correct.
You can't. So the only way to get away from it is to sit perfectly with support. But from there, you got to do exercises that counteract that.
Okay.
And there's some really common issues that we see as far as the cervical radiculopathy and the lumbar radiculopathy that I can 99% of the time tie back to sitting. And even if it came from a heavy deadlift that was done incorrectly, it's because it was the straw that broke the camel's back. It was more load, but it's because they've been sitting for 9 hours a day since they were 6 years old.
Wow.
And that's most people.
Okay.
So the exercises that I will be showing are ways to counteract that force that you've been doing all day, and that's why you do exercises on a repeated basis in a safe, controlled environment, again and again and again, to not only improve obviously muscle strength, but improve tissue healing and actually help repair and reduce the bulge. Primarily, it's always a disc bulge that goes out and hits your nerve, and then the nerve fires up and hits your muscle. So no, it doesn't have to do with the muscle. It doesn't have to do with rubbing on the muscle or needing to do IT band stretches, whatever you want to say.
Right.
And muscles are always, they're responding to something. They don't have a mind of their own. The mind they do have is the nerve that plugs into it. The nerve that's plugged into it is irritated. Then whatever's irritating that nerve needs to be addressed. And unless you address that, it's like going up to a house that continually catches on fire. Every month the house catches on fire, and all you're doing is you're going to put the flames out. You got to find out what the heck caused this. Put the flames out, get in there, repair it, and then we don't have to put the flames out again.
And so when individuals, like everyone, an everyday person, say, has something wrong with their back and seriously injures their back, it really isn't the act that, say, someone stepped down and
there's always a 10%.
Okay.
You know, but for the most part, there's something cumulative. And there's always a reason for it, and it's not just because the piriformis tightened up out of nowhere and that needs to be rubbed out and stretched. It's again, the muscles don't have a mind of their own. Why is the piriformis irritated? Why is it tightened up? It's usually because the sciatic nerve is something's going on with it, and it's telling the muscle, hey, tighten up, guard against, so that you're not moving me too much because the nerve's irritated. And what's the nerve irritated? Most likely, it's an intervertebral disc that's hitting that nerve. Unless you address the intervertebral disc, then we're just, again, putting the flames out every week.
Right. So what are these, give an example of some of these exercises that you would recommend?
So the first one would be more of like what's called a cervical retraction. We should first start by saying, we're not going to say to do it, but why are we doing it? First of all, when we sit, what ends up happening is the lumbar spine loses its lordosis. It loses its lordotic curve. That's going to increase the thoracic kyphosis, decreasing the cervical lordosis. And because life isn't down there, it's up there, we move from our top cervical vertebrae only in order to look up at our work. Now this is exaggerating, but it's exaggerating to make a point. Point being, I'm not in the exact same posture with my spine as I am in standing, and that's ultimately the way we're built. Humans are built for standing, walking, running, jumping, lunging, and when we're tired, we're supposed to lie down. We have now come up with these things called chairs, whereas that's where we relax. We don't relax laying on the ground, we relax in chairs. Who says? Someone said centuries ago.
Right.
But point being, the reason we sit is to relax and
so
to turn the muscles off.
Yes.
So that's why it feels good when we sit, we turn the muscles off. It would also feel just as good if we lie down because we turn muscles off. Unfortunately, when we sit, then we put all that pressure, like I said, we reduce that, the lumbar lordosis. What that's going to do is that's going to take that intervertebral disc. The space posteriorly isn't going to increase. Which is going to, again, that's not the way that the posterior wall of the disc is built. It's built to be actually in a lot shorter than in the anterior portions. Now you're taking tissue that's not meant to be stretched out and you're stretching it out all day long.
Wow.
Since we're 6 years old. If I took my finger and I bend it back and I held it here, it's all good now, but if I did this all day long for 9 hours, we all know that this tissue would be damaged. And things wouldn't work out. The unfortunate thing in the spine is that we have the intervertebral disc that really moves around. That intervertebral disc is a lot like a water balloon. It's going to go where you tell it. And so if you're telling it, go ahead, squish on back there. That wall is going to thin out, and then it's going to have a directional preference to translate posteriorly. When it translates posteriorly, we think, okay, well, we might get a little tear in the disc. Unfortunately, it gets back there and it hits one of the nerve roots. When it hits the nerve root, that's when we got the symptoms going down. The exact same thing happens up in the cervical spine. The exact same principle. And the reason the cervical spine is further, those discs are a lot smaller, and so you think, well, it's not going to respond as much as down in the lumbar.
Right.
But because we look up, because the only way to look up is from our first our first two cervical vertebrae, then that's going to increase. We put an increased force anteriorly straight down, which is just increasing all that pressure to want to go backwards or translate posteriorly. So that's why it's weird. It's such a risk to stretch out the posterior wall of the intervertebral disc, mainly at the lower cervical and at the lower lumbar. And so what these exercises do is they are counteracting that. Not only are they helping push that disc material, just encouraging it to go back to where it came from in sort of an end range. And of course, a lot of these exercises work in an end range. And for example, with the cervical retraction, the idea isn't to walk around here in end range, but we train end range to maintain mid range easier. Because as we're doing this actively, not only are we strengthening up the deeper anterior muscles, but we're stretching out the tissue in the back. The muscles, that is, suboccipitarly, as well as pushing in the lower cervical spine. We're pushing that disc more anteriorly. So the first one is we can combine two. One is going to be the chin tuck. Standing up, we're just going to take the chin, and a good command is make a double chin. That's doing a cervical retraction. So you're just going to go back there. And hold it, and I'm going to combine that with doing a shoulder blade squeeze. We're going to put the hands up, as in like say a robber came in, put your hands up. So you want to put your shoulder blades, you want to bring them back and down. So you're bringing those lower portions of the shoulder blades towards the back opposite pockets. They're mainly we're firing up the mid and lower trapezius because those muscles go on stretch when we sit. When we sit and we increase that the thoracic kyphosis, then the shoulders fall forward. And the shoulders fall forward, then we get a shortening of the upper trapezius, a lengthening of the lower and middle trapezius. So we got this chronic lengthened middle and lower trapezius. And that's also another reason why these are so tight, and they want these rubbed out, and they want to have 1.5 million stretches. I say strengthen up lower middle trapezius, we take the load off of here, then we don't have to mess around with too much rub-a-dub. And so what I like to do is combine that cervical retraction with the shoulder blade retraction in sort of the back and down direction, so you can get sort of a retraction with the shoulder blade retraction as well, the scapular retraction.
And so how often would one do these exercises?
Yeah, for preventative maintenance, why don't you say every 1 to 2 hours, 10 times.
Especially if they are sitting, say, at a desk all day
and most people are. Some people say, I never sit all day, but I just run errands. Sure, well, you're running errands sitting in a car, and we're not the Flintstones, so we drive sitting down,
Okay.
And everything, we sitting, and then this is none of our faults, everybody thinks, there's no guilt, there's no fault here. This is the way that our society is set up. We do sit down.
Right.
But if we want to do something to counteract that, that's what these exercises.
So
and it's real simple.
It's
10
helping,
times.
It's helping build just education about the body and help
And
reduce.
you're reminding those lower middle trapezius
Right.
come on. You're giving that you're giving that little signal to the anterior chest muscles. You get a little stretch, and it's a dynamic stretch, as well as your deep cervical stabilizers to be more active and to keep the posterior cervical tissue a little bit loosened up.
Right. And speaking of back, how about the lower back exercises to prevent development of lumbar radiculopathy and sciatica, as well as the common lower back pains that individuals complain about?
Yeah, exactly. Again, when it talks about the radiculopathy, I'm always going to look. You have to look central. So I'm always have to rule out intervertebral disc hitting the nerve, and the nerve send the signal down the leg. So rule that out most likely because you've been sitting, because we're Westerners and that's what we do since we're 6 years old. That's a really common problem. And in addition to that, so if it's and that has that, and I don't want to just say just bend backwards, kind of like we said with the neck. We do want elements to counteract that forward flexion. But as far as exercises go to prevent that from happening, I want to turn on the muscles that stabilize that spine in its spine neutral position, meaning keeping that nice
Natural
lumbar, exactly, the lumbar lordosis. Our core muscles, what they're designed to do is keep the spine from moving. They're actually anti-movers. They're anti-side benders, anti-rotators, anti-flexors, anti-extensors. That being said, they're not designed for being turned on in isolation in a flexion or in a side flexion with a twist. That will isolate a certain muscle to, if you want to replicate and show that if you're a bodybuilder. That's where those exercises, that's where those crunches, the bicycles, all that stuff came from. Was from the bodybuilding world. They were the first ones to quantify exercises. So that's what they have to do. That's what the pose is for that oblique. That's what the pose is for the rectus abdominis.
Right.
But we can't just say, well, those turn on stomach muscles, and stomach muscles
then support
support in the back. So in order to be nice to my back, I'm going to do these stomach muscle exercises. No, that got no.
See, people think that all the time. They think that I will work on my core, and all of a sudden.
Exactly, but you don't work on your core through actually doing the last thing those muscles would want to do, which is move the spine.
I see.
Because when it comes to movement, in any movement execution that's done, especially with load and under repetition, the last thing you want to do is move that spine. Not only for the health of it, but for the most optimal mechanics, the most optimal mechanical position that you can take from. No sprinter, there's no sport where a more flexible spine comes to an advantage, with maybe the exception of gymnastics, dance, and being a yoga teacher. But
you still need support from.
Overall, though, you need to be nice to that. And
Right.
in addition, most of those people have been sitting, so there's already a directional preference
Right.
that doesn't want more cervical more flexion.
Right. So what should we be
So
doing instead?
so in that case, so what I like is it's all about planks. You want to work your core?
Ah.
Yes, because we have to work our core muscles, but work our core muscles in ways that you are fighting movement from occurring, because that's the role of the core muscles. In order to make a basketball player improve his or her cardiovascular. For the court, you wouldn't just have them swim
Right.
for day on day out and then go out on the court. Yes, their cardiovascular is improved in the in the pool, but that
right.
does not translate to that, which is the same reason for we don't train core muscles. If we want our core muscles to be on to protect our spine, we don't train them in a way that's moving the spine and then think that voila translates
So
into.
a plank really does kind of work with how
Exactly, it's an
natural-
anti-side bender, it's an anti-rotator, it's an anti-flexor, it's an anti-extensor. You're taking that in all directions. So you got the forward plank and you got the side plank, and you could even get more advanced with it and then rotate from the forward to the side plank, so long as the shoulders and the hips aren't moving away from facing the same direction.
And that's what I wanted specifically to talk about is the correct way to do the plank, because many people, if you see people go to the gym, they think, oh, if I'm just like perfectly straight or I'm supposed to be as straight as possible, this is the correct plank. But I've heard too that there's a wrong and a right way to execute a plank.
Yeah, straight, but
What are the
neutral
areas you want to
neutral spine.
engage?
You want to keep that cervical. You want to keep the lumbar low dorsus, the thoracic kyphosis, and the cervical lordosis, and then lock it in place. That's where all the core muscles they lock in place. Just like any, you watch tennis and they sort of, you hear them yell or they grunt before they hit the ball.
Right.
The reason they do that is because under that moment of that grunt or that yell or that outburst, we get a tremendous contraction of every core muscle together.
Wow.
And when that happens, the spine is locked in place, and thus they get more power on the shot because there's not an energy leak coming out of the spine. And it's the same idea of the core. We want to completely lock it in place.
Right.
So we're going to do the front plank, and at the same time we're going to squeeze the glutes. I'm big on the glutes because they go hand in hand with the core muscles.
Okay.
Because we're walkers and we're movers. When our glutes
part at the bottom, yes.
exactly when our glutes engage, they work together with the contralateral latissimus dorsi. And as that keeps going back and forth, we get a nice sling of stability right in the center of our back, where we're most vulnerable. So
and the lower back area specifically too, where many people complain.
exactly,
they have pain.
that's exactly it. Yeah. So with the core, we want to lock it in place, tighten everything up, and tighten the glutes as well, keeping the neck in a good neutral position too, not making sure it's not popped out.
Right.
And it's the same thing to the side. You want to tighten up everywhere. I like to say that imagine you're gonna get poked somewhere in the belly, on the front, on the side, in the back.
Okay.
Somewhere, lock it in place to avoid that, along with the glutes.
So for planks, about how many repetitions, how often?
Yeah, if you want to do them daily, maybe say hold it to good, 10, 20 seconds for.
That's it? Normally some people say,
Yeah,
a minute
3
to
or
do
4.
a plank, but
Yeah, fine, but be realistic. If you're going to do them every day,
Right.
you're just reminding the muscles, just come
Right.
on.
Okay.
You can obviously go further from there, but 20 seconds, three sets.
okay.
Wow,
It's a lot simpler than
and you could go each
Like
side
that.
plank 20 seconds, 3
Okay.
sets. So just 20, 20, 20, 20, 20, 20, 20.
great.
And in addition to that, I'm a big fan of the squat, because the squat is one of those fundamental exercises that just replicates the second thing that we're built for. And first we walk around, but because we've always lived with gravity, we have to get stuff from the ground. So we have to squat to pick something up and keep moving. But again, we squat with a neutral spine. We don't squat with with our
curved.
spine moving at all, because
Right.
that's you're not going to get the same power from there. That's what our hips are built for. They're ball and socket. They're meant to create that movement. The spine isn't meant for that movement. Those little pathetic little joints in the spine are meant to stay together and just go
Align.
through some general reciprocal motions, but they're not built for load and for a tremendous amount of movement. So keeping the spine neutral, that way we're working on the core muscles of the neck, the core muscles of the low back, and then we're firing up those glutes and the whole rest of our lower extremity. Working those muscles that just get completely disregarded when we sit. When we sit, we get real tight in the hip flexors. We stretch and constrict we stretch and smash our glutes. So then when we get up and move from there, we're running more with our hamstrings, our quads, and our calves,
Right.
and IT bands. And it's not, so it's going to translate into moving more mechanically sound.
Wow.
So in the squat, we're going to get feet about a little more than hip about hip or shoulder width apart. Something comfortable. You're going to hinge back from your butt. Your trunk's going to go forward, so your trunk is nearly parallel to the ground, so especially if you got to get to the ground, that's where you have to get. And you're going to keep the knees pressed out, not letting the knees collapse in. And you're going to, what I also like to say is, imagine that you're trying to spread the floor with your feet, so you got a constant outward pressure there. You go ahead and tighten the belly, and keep your neck in check, and you can hold that for maybe 5 to 10 seconds.
And then for squats.
Yeah, for the squats, so you can say 5 to 10 second holds and maybe 4 to 5 reps of that.
Okay. Daily.
That's a good one to do. Maybe every couple hours.
Oh wow.
Yeah, when you stand up, you do your cervical and scapular retractions, along with doing those squats. You even combine it. You can do the squat as you stand up. You do a couple of those cervical and again, it's just a counteract. If you've been sitting, that's a mechanical position that you're giving yourself a directional preference in that. Counteract it with those exercises, because ultimately we were built for being upright and moving, but our jobs don't let us do that. So,
right.
And then one more, talking about the connection between the latissimus dorsi and the glutes, creating that sling of stability there for the X marks the spot right in the thoracolumbar fascia. A really good one that combines those muscles to turn on as well as the core muscles is from the quadruped position. We're going to kick one leg back, so we're doing a hip extension.
Okay.
On the contralateral side, you're going to do a shoulder flexion. So there we're getting, and really being conscious of the fact that your tummy's tight and that you're contracting that glute that's holding the leg up, as well as when you're doing that the contralateral shoulder flexion, you're really thinking of your shoulder blades going back and kind of trying to picture that latissimus dorsi driving down, and then from there, without the spine moving at all, you try to bring your elbow and your knee towards one another and then back out. So there, your brain is working with hip movement, shoulder movement, together with spine stability. That's what the muscles are designed for. Not every muscle in the body has the exact same function or the same shape. Mm-hmm. Again, the core is supposed to keep the spine from moving. Our hips and shoulders they're the ones that move us.
Right.
Ultimately, watch somebody sprinting, and what's going on is there's a tremendous amount of leg and arm movement, and the core. And the reason that's going on is because the core doesn't go anywhere, and the person's able to move mechanically more sound. They're going to get a faster sprint, and their spine's going to be more protected. So that the quadruped swoop that I call it, maybe do 5 to 10 in a row, as quick as possible, and do 3 sets on each side. And again,
how often? Daily?
That can be a daily one. That can be daily together with the planks, just sort of because if you're getting it in daily or 5 days a week, you just keep it in check, so to speak.
So you're really talking about just taking a minute or two every couple hours to just do the opposite of what your spine is doing all day, and you'll prevent neck and lower back pain with these simple exercises.
That's the idea.
Great. I think that's something that people can start on a daily basis. Mm-hmm. So, well, thank you so much for joining us today and sharing these exercises. Everyone start doing them, just because it can help and maybe reduce the cost of the need for going to a masseuse, once a week. That's a lot of the time people say to go to like a chiropractor or like a masseuse.
Great treat,
it is, but you prevent it from doing these exercises. So thanks, and come back again and join us for our next topic.
Neurology in Primary Care, developed by Templeton Institute for Neurology. Templeton Institute for Neurology is a comprehensive neurology practice dedicated to the diagnosis and treatment of neurologic disease. We are located in San Luis Obispo, with a satellite office in North County. Our Neurology Second Opinion Clinic in San Francisco is held once a month. We apply the same excellent standards we use assessing patients who see us for an initial consult to the patients who see us for a second or third opinion. This is why our success rate is more than 38% in changing diagnosis or treatment when we do a neurology second opinion. We do not promise miracles, but we frequently change quality of life. This review, even though it's comprehensive, should not be used as the sole source for physicians when they are making decisions regarding treatment of their patients.